Okay, we'll get started in 5 seconds. 5, 4, 3, 2, 1. Hello, everyone, and welcome to another episode of Learning Corner. In this Learning Corner, we always promise that you learn something new today, and then what we have today is responsibilities of patients. Recently, I visited an hospital for my father, and then there are these things written on the wall of the hospital. I mentioned Alliance Hospital, the name of the hospital with a reference as well, and I really liked it. Then I started thinking, as being healthcare professionals, it is very important to know these things. A lot of times, there are things which we look at but we miss. We kind of let it go. But yes, I think responsibilities of one patient is a very good to know for all healthcare professionals. And by any means, this is not a comprehensive list. This is what I saw and I really liked it, and I feel it is actually comprehensive. And today I am trying to interpret it in my words. Let's see if you like it, and then let me know in our communications or comments. So let's start it. Think about it. I mean, all of us go to the hospitals, any sort of healthcare services providers. Assume as a patient. Now, what are our responsibilities? Because we are also responsible for something. At the end of the day, the success of a patient is twofold. One is how does the healthcare professional provide the service, is one aspect of it. Another aspect is also how does the patient respond to it. If both are well, then definitely both will be successful, which means the patient will be very healthy, and then the healthcare professional will also be happy because he or she will feel that he has served a patient really well. So in that spirit, let's see what this hospital says are our responsibilities of patient, and it's very interesting. Let's go one by one. The first is to faithfully undergo the agreed therapy. Okay, a lot of times doctors prescribe some sort of therapy to patients, but at at the end of the day, to be successful for that patient, the patient has to be responsible and has to undergo the agreed therapy. Let me repeat, it is just saying that patient has to listen to the doctor on the agreed therapy. Agreed? Okay, let's move forward. The second one, to follow doctor's instructions diligently. This also a responsibility of patients. Uh, let's say I go to a dentist, and then let's say I do something, I clean my teeth, I whatever, etc., something is there for the teeth, and then doctors give me some sort of instructions. Let's say eat this food, don't eat this food, take this tablet after food, before food, or after breakfast, before breakfast, and all those kind of things. So it is patient's responsibility to follow those instructions. A lot of times what happens is, if a course of tablets as an example is given, usually we take the tablets for a couple of days, and then after second or third day, it is very hard to remember that we have to take the tablet. But it definitely impacts the treatment overall and the health of the patient, and obviously the relationship between patient and the doctor as well. So it is very much necessary that the patients themselves become responsible, understand the importance of the instructions given by the doctors, and follow those instructions very well till the course or the therapy ends. The third one, take necessary preventive measures in case of infectious diseases or similar. I think this became very much apparent in case of pandemic, because if there is any sort of cough cold fever or similar things which are visible for a patient, they are advised to follow the preventive measures, which is nothing but apply sanitizer on hands and then wear masks. So this is also another responsibility, that patient should use these preventive measures just to make sure that the atmosphere around them, either be it in hospital or at home, is very well maintained. The fourth one is obvious, to make the payment for the treatment. We all understand that hospitals are also in need of money. They have people or doctors who work there. Their salary has to be paid. It takes a significant amount of investment to purchase the equipments, rent a building or buy space for the building and all those kind of things. So it's a heavy investment. It's a heavy investment in there. So obviously we have to make sure that if we are using or utilizing services of a hospital or a doctor, we should be responsible enough to make the payment for the treatment. The next one is to respect the autonomy of the doctors and nurses. A lot of times there are many ways uh, uh, which are used to treat a patients. Different doctors or nurses may have different ways of doing a particular thing. There can be different ways of doing particular things in specific sequence. So I think what this hospital specifically is saying is that patients should be responsible enough to give that autonomy to doctors and nurses. Let them do their job. They are responsible enough in themselves, and they understand that they are treating a patient, and then it is in their best interest, both the patients and the hospitals, that the patients get healthy and recover as far as possible. The next one is treat doctors with and nurses with respect. I mean, obviously, we all treat doctors and nurses with respect, but whenever a conversation with a doctor or nurse comes, explain what are you going through, what has happened. Never hide any information from the doctor, because it it ultimately hurts you as a patient itself, because if some information is hidden, doctor is not considering that information is in giving you the medication. So never hide any information from the doctor, and I believe that is also uh, giving respect to the doctor. Next, be punctual to attend the treatment at given time. We all know that most or maybe a lot of doctors or hospitals, clinics are usually busy, and then people also tend to go there when the time is peak. Probably, think about it, evening 6 to 8 is the busiest time. So if an appointment is given, then it is responsibility of the patient to kind of attend at that specific uh, time during that appointment. So it helps the doctors, it helps the patient themselves, as well as it helps the other patients who are in line for the treatment. The next is preserve all records of illness. I believe this is a discipline from each patient's perspective, but this is very important, just to make sure that all the records are maintained. Usually, most of the hospitals give files for this reason. So let's take an example. Whatever, I think, the prescription from doctor, the blood reports, if there are any other reports or information pages, they can be attached to the file, and then the file can be kept for your records. So if you, let's say, visit a doctor maybe once a year or so, then you can have an yearly file and put all those docs in the file. It helps you get better treatment, or provide the context to the doctor next year when you visit, and that ultimately helps you in getting better treatment. So I think being responsible in the records is also very important. The last one is to keep the doctor informed if the patient wants to change the hospital or doctor. Let's talk on this for a minute. I think a lot of times if there are multiple uh, family members involved, some of the family members think that this doctor or the hospital is good. Some thinks that there are other doctors or hospitals which are better than the present one. In this case, the family has to be very transparent to the uh, to the uh, to the hospital and the doctor that they want to take something called as second opinion. It's a very famous word in healthcare professional. So if you take a second opinion, this means that you prefer to speak with another doctor. You will show the similar reports to the doctor and take their opinion and see. And it is about trust. If you speak with multiple doctors and multiple, or maybe two or three, not more than three, but if all three suggest the similar treatment, then mostly that's the right treatment, and then the patient earns the trust that now me or my family member should undergo this treatment. And then this is very much important, especially if the surgeries are maybe spanning across period of weeks, or the surgeries or other treatments which are very critical in nature. This also is very important if the patients are senior citizens or similar. So I think this is the I believe comprehensive list of responsibilities of patients. Being a healthcare professional, I think all these uh, things are really good to know. A lot of times we kind of tend to overshadow the things which are very obvious, and then these things are very obvious. But I just wanted to let all of you know that this is very important. So just keep these things in mind, which is nothing but that these are responsibilities of the patients. There is something called as rights of the patients as well. Let me speak about it maybe in future learning corners. But let me know what do you feel about uh, this episode of Learning Corner. And I believe you have learned something today. This is the promise of each and every Swaasa influencer. I wish you good luck in your career, in whatever endeavor you go forward. Thanks for listening. Have a good day.